welcome to all our esteemed panelists and speakers who bring a wealth of expertise and experience in today's, webinar. I would like to tell participants that you may not be able to see each other, but you're not alone in the room. All of us are here, or many participants are still joining. So if you don't see the names and who else is participating, don't get upset or worried. We all are in the room. Just quick, before I hand over the session to Shubhagita to moderate, just 2-3 things that you can please drop your queries and questions if you have in the Q&A box that is shown underneath the screen. And we will come back to you once the sessions are done and when the panelists and speakers have spoken to respond to some of your queries there. And also please mute your mics if you're not speaking so that we can have lesser, disturbance and more focus to the webinar. So thank you very much again for joining in. And I will now hand over to Shubhagita for the session, to moderate the session 1.
Thank you. Good morning, good afternoon, good evening. It's wonderful that this webinar has generated enough interest. And we're looking forward to discussing taking the M&E frameworks and to also incorporate gender monitoring indicators within national and local indicators. That's the main focus of this this webinar on issues around it. We ourselves at SCI-AI have managed to do quite a bit of work on this bottom up, and some of this will be presented in this workshop, and we are looking forward to getting comments from the panelists, and please do give feedback on the Q&A, and our panelists as well as presenters will be answering them. With no further ado, in general, the session is in 2 parts. The webinar is in 2 parts, one of which, the first one, is around looking at monitoring and evaluation opportunities and challenges in general in engendering gender in WASH. The second one, of course, is a deep dive into measuring gender in urban sanitation, key lessons from some of the work we've done with a lot of partners, and taking that forward. At this stage, I would also like to thank the National Fecal Sludge and Septic Management Alliance for being part of this exercise, and of course the AIT GWSC, which has been our host for close to a year now. So in this first half, we are first going to have a presentation from Dr. Sheila Sinaroy from the Emory University, who will give us a flavor of what internationally this measuring regime might look like going forward. It will be followed by a presentation by Anju Dwivedi and Abhinav Kumar from SCI-AI on our look at how these policies and programs and monitoring frameworks at this current time in India seem to gather or not gather information in a disaggregated gender lens, through a disaggregated gender lens. It will be followed by a panel discussion, a set of comments from Sujoy Mojumdar, Senior Water and Sanitation and Hygiene Specialist at UNICEF, who has worked both in the government as well as with international agencies. So we really look forward to his comments on regarding taking forward some of this work. Also by Dr. Astha Dang, who was a gender evaluation specialist with a PhD on the topic, with and does a lot of work from 3IE focused on evaluation. And we look forward to how her research, from a research perspective, how this might look going forward. and Isha Bansal, Chief Operating Officer, Deputy Chief Operating Officer from GWSC AIT, who has tremendous expertise of bringing both international financial institutions and government programs together to deliver some very innovative projects. So from from her angle, we will also get to hear on what might be next steps in embedding some of this at the national level. I'd like to at this stage call upon Dr. Sheila Sinha Roy, who has kind of led this exercise at the global level and is in the final stages of incorporating this in the WHO UNICEF framework. So over to you, Dr. Sheila Sinha Roy. And just with the last thank you to all the panelists for making it here, and it'll be surely invaluable discussion for the sector at this time. Thank you so much. Over to you, Dr. Sheila.
Thank you so much, Shubhakato. I am really pleased to be able to share this work with everybody. Thank you very much to SCI-AI and the organizers for inviting me to present this work, which is a collaboration between Emory University, WHO, UNICEF, and many participants in the various consultations that we've held over the years. So to start out, as background, of course, I'm sure we are all familiar with Sustainable Development Goals 6.1 and 6.2, which aim to achieve universal and equitable access to safe and affordable drinking water for all, and access to adequate and equitable sanitation and hygiene for all. I'm sure we're also familiar with the fact that 6.2 specifically mentions paying special attention to the needs of women and girls. Yet at the same time, there are no gender-specific indicators for monitoring SDG 6.1 and 6.2. SDG 6 as a whole has been labeled as gender blind by UN Women. And so there was a clear need for gender-specific indicators, and WHO and UNICEF, as the data custodians for SDG 6.1 and 6.2, approached Emory to help them identify gender-specific indicators that could be incorporated into their ongoing monitoring. And so we undertook this process together with the JMP, beginning almost 4 years ago now. So this has been quite a long process that began in May 2020 in 2 overarching phases. And I'll talk about each of these in more detail. But the first phase, again, beginning almost 4 years ago, was a review of opportunities for enhanced monitoring of gender in relation to SDG 6 targets 6.1, 6.2, 6A, and 6B. I will mainly focus on 6.1 and 6.2 in this talk. And then through that review process, that led to a second phase, which was a prioritization process. And again, I'll talk about each of these in more detail. So the first phase of the process, beginning in 2020, was this review that had several aims. The first was to identify the relevant dimensions of gender equality related to WASH. So what should we be measuring? What should we be aiming to measure related to gender and WASH? Then to identify existing and potential data sources and tools for monitoring each of those dimensions that we identified. So what already exists and how can each of these dimensions be monitored? And then to look at those data sources and tools that we identified to identify gaps. So what exists, what remains as a gap? Where are there opportunities to leverage existing data? So what data is already being collected that we can leverage? And what additional data needs to be collected to fill the gaps that we've identified? So this was this review process that went on for over a year. The first step of that review, like I said, was to identify relevant dimensions of gender equality related to WASH. And to do that, we built a conceptual framework, which is described in detail in this report that you're seeing here on the screen. This report and all of the reports, all of the documents that I'll be showing are available on a JMP website. So of course, the JMP website is washdata.org, and they have a page on their website that is devoted to gender. It describes this whole process, and it has links to all of the documents that you're seeing here. So for more information on any of these, you can find the document and read more. This is the conceptual framework that we developed with 4 dimensions related to gender equality and WASH. And so let me turn on my laser pointer here just to walk everyone through it. So this first box on the top left is access to resources. These are things like safety, privacy, health, knowledge, time, which then lead to ability to exercise agency and ability to meet WASH needs. So access to resources leads to ability to exercise agency because, of course, certain things have to be in place for us to be able to exercise our agency. For example, a person needs to be able to feel safe to be able to then participate in public events and move freely in their community. Similarly, the bidirectional arrow indicates that ability to exercise agency also influences access to resources. So household decision-making, for example, can influence how much time a person has available related to WASH, related to water, sanitation, and hygiene activities that or their roles, their tasks that they may be performing. Each of those together can influence their ability to meet WASH needs. So again, feeling a sense of safety, having privacy can influence whether you are able to meet all of your WASH needs, including menstrual health and hygiene needs. And similarly, decision-making, for example, can influence the design of a toilet, and so your ability to meet your WASH needs. All of those 3 dimensions are situated within this multi-level enabling environment, which includes things like social context, norms, legal frameworks, etc., which influences everything, influences the other 3 dimensions. So you can see there are some complex bidirectional relationships in which each of those 4 dimensions influence each other. So, sorry. Moving on, the next step in the review process was then to identify existing and potential data sources and tools to monitor each of those 4 dimensions that I just described. And to do that, we created a compendium of tools. We ended up identifying 78 different tools that related to the 4 dimensions of the conceptual framework. We coded and sorted all of the tools. And so the full inventory, again, is available from the JMP website that's linked below. And the full compendium has the list of 78 tools, and it has 15 additional tabs. You can download it. It's an Excel spreadsheet. It has 15 additional tabs for each dimension of the conceptual framework, and it lists individual survey items related to each dimension. So it's we try to make it as comprehensive as possible so that it can also be a resource for people to use if they are interested in measuring any of these dimensions of gender equality related to WASH. We then took all of those data sources and tools and looked for gaps. So what tools already exist to measure these dimensions, and where are there missing, where are there gaps in the tools and data sources that are available? And then we tried to identify where existing data was already being collected that could simply be reported on by the JMP, and where might there be opportunities to collect new data using these tools. This was a very consultative process. We had 3 rounds of online consultations with experts in gender, WASH, and measurement to try to make sure that we weren't missing anything, because of course we, as our core team, can't be aware of every tool, every data set, every data collection mechanism. So we really tried to get as many people involved to make sure that this was very comprehensive. And then we synthesized all of that work and learnings and made recommendations for next steps. So this is another report that you're seeing here that is also posted on the JMP website that summarizes this whole first phase of work. We then moved on to the second phase, which was prioritization, because of course we had recognized that it's not possible to measure all of these things. The JMP cannot start monitoring every aspect of this conceptual framework related to water, sanitation, hygiene, and menstrual health. So we needed to prioritize. So we started this prioritization process, and the goal was to determine the priority areas for monitoring based on the conceptual framework. So you're seeing again the conceptual framework. You can see that time and labor is highlighted here under access to resources. And the reason why it's highlighted is because that's one of the thematic areas that was determined to be a priority specifically for water. Because of course we know that women and girls in many settings bear the primary burden for water collection, and that affects their time and labor. And so that was something that we determined was a priority to begin measuring. And so to do that, we went back to our long list of indicators and used the compendium that we had previously created. So within the Excel spreadsheet that I mentioned, that compendium, the tab for time and labor has 184 rows of individual survey questions or items that could be used to measure time and labor. So out of those 184 items that we had identified in the first phase, we then had to narrow down and make recommendations about what should be used for measurement. And so we narrowed down our long list based on external review. We deployed a survey to over 100 experts in gender, wash, and measurement. We had a public open comment period. So the long list of indicators was posted on the JMP website. This was about a year ago, almost a year ago, last summer. It was posted on the JMP website for anyone to view and comment. And through that process, we collected quite a bit of quantitative and qualitative data, getting people's input on what should be included in the final list of indicators. And through that process, we finalized the list of priority indicators for gender in WASH under SDG targets 6.1 and 6.2. The report that you're seeing here is the final report with the 15 priority gender-specific indicators that have been recommended for monitoring in collaboration with the WHO and UNICEF. And as you can see from the date at the bottom of the report, this was just released last month. So this is a very new output, and there will be some additional dissemination events. The WHO will be launching this report, but it is available now on the website for people to download and start reading. Obviously, I can't go through all 15 indicators. I don't have time, but just to show you an example, again, returning to the thematic area of time and labor related to water. One of the indicators is the average time the primary water collector spends per day collecting drinking water by age and sex. So for each indicator, it tells you the indicator, it gives you some basic information like the definition, the preferred data source, the validation, so whether the survey tool has been previously validated already, the data availability, and future data collection. So for example, you can see this, this indicator, data are already available from data collection in the DHS and mixed surveys. And so that was something that we really aimed for. We were looking for indicators for which there is already data being collected and that wouldn't place an additional burden on governments, on data collection agencies to collect completely new data that hasn't been collected before. We were aiming for user friendliness with these indicators. So finally,
Dr. Sheila, 1 minute, please.
Yes, this is my last slide. Thank you so much. So just to wrap up in terms of next steps, the priority indicators, we will be promoting, the JMP actually is taking this up. Emery's work on this part is finished now. And so the JMP will now take this up to promote, those indicators, encourage people to report on those, and to generate additional data at scale, of course, at the national and global level for comparison across countries. And for those indicators that do not have validated measures, it will be important to continue validating the new measures and generating data. So finally, to thank everybody who has been involved, the funding, of course, for this work came from the JMP. You can see our core team listed here, led by Bethany Caruso, my colleague at Emory University, and in close collaboration with the JMP team, Aicha Dönmez, Rick Johnston, Tom Slaymaker. And you can see just some of the names of the many, many people who participated in the online consultations, surveys, public comment period, et cetera. Again, this was very consultative, and we really appreciate everybody's input. Thank you so much, and I'll be happy to take questions in the Q&A or later on during the panel.
Thank you so much, Dr. Sunaroy. That was excellent. Gave us a perfect overview for the next presentations and discussions. I would like to now call on Anju Devedi and Abhinav Kumar. Anju, of course, is very familiar with everyone here. Everyone knows her well. She's been leading a lot of WASH and gender work in India for some time now. And Abhinav is our key person who works with data and understands data bottom up across all the various platforms that monitor WASH in India. Over to you, Anju.
Yeah, thank you, Shubhakta. Abhinav, can you please share the screen? Yeah. Yeah, so we had the presentation on measuring gender in WASH, taking example from India, basically reviewing various policies and programs and the M&E data systems. So sanitation and gender are very much interlinked in the sense that they both mutually reinforce each other in terms of, seeing that if you improve the sanitation in any country or in a place, the gender outcomes are achieved. Access to improved sanitation improves health, also improves the educational opportunities for the young girls who spend time in fetching water or going far off places for sanitation, for accessing sanitation, improves access of women and many other gender groups to employments, because they can now have employments in places where they can go. And also there are many employments generated through sanitation, which are more dignity oriented and nowadays. And also access to public spaces where people, as well as, many women and transgender who often faced challenges in accessing public toilets and all, can go and can be workers and also can be the consumers and go to the market without bothering too much whether you will get the sanitation facility there. So I think this actually has a very important positive outcome on gender. Now, our presentation is basically divided into two sections, where one section deals with adequate data, whether there is an adequate data on monitoring or measuring the impact of sanitation on gender relations. And the second part is basically the WASH policies and programs, how they've evolved over a period of time, and whether they are transformative or inclusive at all. So I'll be dealing with the part on WASH policies and programs, and Abhinav, my colleague, will take the second half of the presentation. Next slide, Abhinav. So not spending too much time, because we all are aware here that, gender and development as an approach has only been mainstreamed in mid-90s, when there was a lot of, the international conferences. There was a World Conference on Women, and the Beijing conference actually in what I would say infused a different kind of energy into various multilateral and bilateral programs that force the governments to include gender as an important component in the policies and programs. So, and then of course it got reflected in the Millennium Development Goals and the Sustainable Development Goals also. We're looking at 17 indicators. Next slide, Avna. And we actually look at this gender equity continuum, and this is very important to which Sheila also had mentioned in her previous presentation. It's very important spectrum to understand where the policies and programs stand or are fitting. So in this spectrum, you have on the left side, an approach which is totally blind or unequal, which doesn't, recognize that there is any, gender-based inequalities, and therefore there should be any programs and plans based on that, to a situation which is very transformative in the sense where, transformation of power and the redistribution of power and resources take place, women and men, and also the third gender now. But within that, there is this gender intentional or sensitive approaches, which acknowledges that there are gender differences, there are gender inequalities, and therefore they need to be, men and women specific needs have to be addressed differently, and there should be different financing mechanisms also. So that recognition is very important, and that is now being recognized, slowly in our, sanitation program, especially in India, and also in South Asia, which we could get some hang of. So I will be presenting some important policies and programs in India. Abhinav, next slides you can go to. So this is, just before 2008. In any case, we were into this gender blind or gender, unintentional approaches, where many though in any case, urban sanitation program, there was hardly any urban sanitation program focusing on universal access to sanitation before anyway 2014. But NUSP was first strategy on sanitation policy, in 2008, which actually recognized women as an important stakeholder. But that it was only the objective that they had stated, and nothing was there in the policy which looked at how it is going to affect women, how different programs and plans have to be made in order to promote women's participation or transgender's participation. It was only during SBM Urban that we see that there was some kind of focus, but not much, on intentionality and transformation. It was only SBM Urban 2.0 and 2018, which was the gender responsive guidelines that SBM Urban had come up with, which actually promoted gender sensitive approach, recognizing that men and women's needs are different, and women, especially women within women category, and the third genders were recognized later in 2021 and 22. So this was the policy landscape, which also evolved over a period of time, and a lot needs to be still done if we have to move towards gender transformative outcomes. But still, the policies started recognizing different needs of gender, including transgender. Next, Amina. So if we just look at, we just bundled it, not very clean, or I would say a very, neat fit, but still, if we see all these programs, we still feel that NULM, which talks about mobilizing communities and SHGs by giving them voice and agency, is one platform that is very necessary, especially when we're talking about access, agency, and authority framework. And SBM2, which is remarkable in the sense that it has shown some progress. And as we move forward, I think the sanitation policies are going to be more transformative. So we look at this access, agency, and authority framework, which Sheila also alluded to her in her presentation, which is basically, we are saying that if the policies and programs have to be analyzed, they have to be analyzed from these three lenses. One is the access, that you improve access to resources, which are physical, material, financial, agency, giving people or the women the agency or the collective voice, and giving them enhanced capabilities, and the authority, where they actually participate in the policy making, take a lot of decisions in the program implementation, and don't just remain beneficiaries, but become the partners in the process. So just a quick this thing, it was already said, so I'll not take too much time. Just that, if you see the later part of the slide, which is talking about Amrut 2.0 and SBM, which are moving towards, having including all these three, what I would say, three focus areas, while stating at least the objectives of access, agency, and authority. And we need to improve a lot. So there is a journey which we have to collectively tread on, but I think it's a good start to say that, gender intentional outcomes, or at least the policies have started recognizing it. Yes, Abhinav, you want to go to the,
Yeah, thank you. So after we have looked at the policies and the programs, we started looking into the data and the monitoring frameworks that is available in India at different governance levels for monitoring WASH. So we started with the global level, which is the SDG, and as Dr. Sheila has already shown that out of all the 17 SDGs, gender water and sanitation is one of the SDGs which have no gender specific indicator. If you look at health or education, Then a lot of gender-specific indicators within those SDG goals. So there's a lot of work that needs to be done from the in WASH with respect to gender-specific indicators. Then we started looking at the national indicator framework. So this is the framework that Ministry of Statistics and Program Implementation in India has, which sort of creates system for reporting at the SDG level. So in this, there are different goals, and we see that water, gender and water and sanitation feature in some of them, but mostly as proportion of schools with separate toilet facilities for girls, rather than taking a more broader gender empowerment view. So it has a very limited focus on gender. Then we started looking at SDG India Index, which sort of scores or ranks a state based on the SDG progress they have made in SDG goals. And here also we see that there's only one indicator which talks about both gender and sanitation is percentage of the school with separate toilet facility for girls. Similar to what is there in the national indicator framework. Then we also looked at the city level frameworks, and there's only one city level framework, first survection, which sort of scores urban local bodies on service level progress, certification level, and feedback from citizens. And in this also we see that there are only two indicators which are in the category of citizen voice, and they normally talk about informal risk figures, women, transgenders, which should have minimum 33% representation in social support groups, and then whether public toilet units have separate toilets for men and women. There are some other indicators also, but their gender has come as a sort of a good thing to have, sort of an advisory kind of thing. It's good to have gender or specific initiative for men and women and transgenders, but they're not scoring them on that. So that isn't mandating it. So after looking at the monitoring frameworks, we started looking at the data sources which collect data on WASH and gender. And these are some of the data sources that collect for the National Statistical Survey, there's National Family Health Survey, the Performance Assessment System by CWAS, there's Indian Human Development Survey, which happens every 10 years, and this observation. We sort of chose both NSS and NFHS because these will happen at a more regular frequency and at the national level, and give data at the national, state, and district level. So we looked at the periodicity of 4 to 5 years. Both of them are repeated. Then they're representative at national, state, and district level. NSS doesn't have a separate men and women questionnaire, but NFHS does have a separate men and women questionnaire. Both of them, government has an involvement in that, and both of them are household survey. So we started looking into what kind of data is available. And broadly, you can see we divided the data that is available into two groups. One which looks at sanitation and water sanitation hygiene. So we look at access to improved sanitation, access to water supply, and access to hygiene, which includes solid waste collection, menstrual hygiene, and access to bathrooms. That's one set of data that we're looking for. Another set of data is more related to gender empowerment. So we look at economic empowerment, which is basically economic role that women are playing within the household, in market, whether they're employed, how financial literacy and all that. Then we look at political empowerment, which basically looks at whether women are involved in collective action, mobilization, social movements, whether they're able to influence decision making. And then in social empowerment, where we're basically looking at what kinds of changes are happening in common culture norms, community practices, which sort of affect the agency of women. Then we sort of looked at three data. So first is the NSS 76 round, which happened in 2017-18. Then we looked at NFHS 2019, which was the last round happened in 2019. And then the MIS 2022, which is conducted by NSS, and it has been named as Multiple Indicator Survey. And this is MIS is being used to sort of report data on SDGs, so it's very important in that sense. So we looked at access to piped water supply. So we see that NSS 76 round and NFHS both collect data on access to water as well as care burden of women. So they do specifically ask who fetches water from outside. But in MIS, we see that data is not collected. There's data on access to water and care burden, but they are not asking gender specific question like who is fetching data, who is fetching water. Then we looked at access to improved sanitation. So again, in NSS, which happened in 2017, they collected data on access as well as use of individual members of the household. But in NFHS and subsequent NSS or MIS, that information was not collected. Similarly, we looked at hygiene. Again, we see that hand washing questions are missing in MIS. They were there in NFHS and NSS was and NSS also. Then we started looking at social empowerment, economic and political empowerment. There we see that there's some question related to social and economic empowerment in NFHS. And MIS also asks some questions about economic empowerment, which is a progress over the last round of NSS, where there is no question related to social, economic, or political empowerment. So we see that there is a one step forward and two step backward kind of scenario with the kind of data that is getting collected. Then we basically look at, we have looked at WASH policies and programs, and we see that there is a gradual evolution of programs from being gender blind to intentional to gender transformative, and there's a good amount of progress in how policies and programs in India have been responding to gender. But when we look at the M&D system and data sources, we see there is a lag between with respect to policies and programs. So there's very little data around gender and WASH, and even the monitoring and indicator monitoring frameworks also do not pay enough attention to how gender has to be monitored in WASH. And as you move down the governance scale, you see that this challenge becomes even more important. So, for example, Swachh Sarvekshan collects, as far as service provision collects very little data on very little sex desegregated data and almost no data on gender specific indicators. So that's the overall view in which we see that WASH policy programs are getting at and entering into the domain of gender transformative, but the data and monitoring framework still has to catch up with policies and programs, and this problems becomes more and more important as we sort of move down the governance scale at the city level. Thank you. That's all.
Thank you so much, Abhinav, Anju, Dr. Sinha Roy. Thank you so much that laid out very clearly the problem, the opportunity that we face going forward. Essentially, with so much of effort going into understanding better shaping our policies to have a more inclusive approach to incorporating diverse gender issues into these programs. It's essential that our M&E frameworks also shape up. Internationally, we seem to be already arriving at that juncture. And so that leaves a lot of questions for us, both nationally at the state and at the local government level. And we are delighted that we have such a rich set of panelists, which includes Sujay, Dr. Astha, and Ms. Isha Baisal, who all bring in unique perspectives, can bring in unique perspectives to a set of questions around what might be next steps. So in general, that the background of the questions for our panelists today are about, given that the global indicators are more or less in place and it's a matter of time before they are put out, what do we need to do to institutionalize these indicators at the national government level? And even at the state level, maybe, and what are the challenges that you foresee from your end? Another is that how can key stakeholders, including development partners, kind of contribute to this process of incorporating a better measurement around the gender outcomes that we seek to deliver? And what kind of capacities would be additionally required to engender gendered M&E in WASH? So I'll first like to invite Sujay Mojumdar from UNICEF to kind of comment on this. We have 5-6 minutes per panelist, and we really look forward to your comments and guidance on how to take this forward. Thank you. Over to you, Sujay.
Yeah, thank you. Thank you so much, Subhagato, and thanks to Dr. Sheila and to Anju and Abhinav for the presentation. I will try and complete it in 5 minutes. So I'll start. So 1 minute I'll spend initially. Anju and Abhinav, thanks for this India overview. Anju ji, you spoke more about urban. I'll add half a minute about rural. As you know, I think most of the audiences are from India. We do have some global participants. India is almost 70% rural, and we have 2 large-scale rural programs for water and sanitation. Now, I have had the opportunity to work in both the programs. Both the programs, I just want to mention for your knowledge, the Swachh Bharat Mission Gramin and the Jal Jeevan Mission mention gender once in their guidelines, one time each. And women is mentioned around 10 times each in both guidelines. But in both, the mention is around participation of women in village and water sanitation committees, and that there should be 50% reservation. There is no mention about specially focused programming for women. As such, there is something mentioned about community sanitary complexes, and there should be special complexes for women. But beyond that, it is not specifically mentioned. I agree that over the past 5 or 6 years, there has been increasing focus on gender. In Swachh Bharat Mission Gramin, in 3 years back, they didn't bring out a gender advisory for states and how gender should be focused in the Swachh Bharat. But as has absolutely correctly been pointed out, there is no monitoring indicator. And as far as what programmers like us do, what is not monitored does not get done. So because there is no monitoring indicator for gender, therefore, most of the gender interventions does not get translated into activities, into programs. So that is the first point I wanted to mention. The other things in the Jal Jeevan Mission, there are 2 indicators. They could be an interest for those. One is reduction of drudgery of women for collection of water. That is a part of the Jal Jeevan Mission Rural Water Supply Scheme indicator. This is basically comes from the NFHS NSSO background of how many hours is being spent by women to collect water. This is mentioned in the guideline, but it is not actually measured by the Jal Jeevan Mission program. The other indicator that they have mentioned specifically is reducing school dropout rates for girls. This is an outcome indicator that is measured in the, that is not measured, that is mentioned in the JJM guidelines, but again is not measured. So that is the background of rural. The other point I wanted to say, Abhinav, thanks for your analysis of the NSSO 76 round, NFHS 5, and the multi-indicator clustered survey by NSSO. These are all independent, government-led, third-party surveys. But if you look at the indicators, it is basically again moving around drudgery, time spent. This is the kind of flavor of the indicators. It does not really measure actual interventions that have happened to be gender transformative. So I think there is some work that needs to be done there. And the other thing is government MIS systems, which is the actual MIS systems which inform the government programs, both the Jal Jeevan Mission Rural, the SBM Sanitation Program Gramin Rural, and I don't think, even the SBM Urban, I don't think there is government data which is reporting on gender issues.
Yeah.
So because that is not happening, therefore, program implementers, like a water supply scheme is being set up, where should it be set up? Are the women of the village being consulted? I've seen many places that the community toilet is being placed 2 kilometers outside the city center, which makes it impossible for women to go there in the evening to use. So planning for water and sanitation does not have the gender transformative lens or the input that goes into it. Now, the question is, how can that happen? Obviously, that's why we are all here. And I thank Dr. Sheila for, I think, explaining the process of the indicators that have been decided for the JMP. And so I was going through the paper that you had sent and saw the 15 indicators. They were interesting, but I think there will be a need to really, look at how they are contextualized for the Indian context. Because now the government is pushing for a piped water system into homes. So the question of spending 1 hour for collecting water has become redundant. You know what I mean? And the issue of safety may be redundant to some extent. So possibly a need to contextualize it for the context we are in. That is point number one. And the second is how these indicators, whatever we decide, how the learnings can be, or how the information can be collected, interpreted to inform program and influence investment. So the Ministry of Panchayati Raj has a Mahila Sabha system in which every village has a women's group which are supposed to be empowered to influence decision for the Gram Panchayat development plan. The challenge is to bring the indicators into a usable form, get the inputs from the community, and then let that input influence the planning and the investment decision. I think that is where we look forward for partnerships for experts in the field. UNICEF is working. Last point, this year, we did an initiative, end of last year, sorry. We got in the joint monitoring program. Tom Staymaker and Rick Johnson were in India for a week, and they interacted with both the Ministry of Urban and the Ministry of Rural. And I think they spoke about how data is being collected, and gender issues was not part of that discussion. But now that we have the indicator, we'll try to include that too in the gender sphere. I stop here. I think I've exceeded my time. Over to you, Subhagato.
No, thank you so much, Sujay. That was super helpful. I'll now like to hear from Dr. Dang, means from your perspective as to how a process of incorporation would look like, so that, as Sujay mentioned, that it's also contextualized, right? And it's useful for programs to evolve. It kind of helps programs to evolve. Over to you, Dr.
Thank you, everyone. It was a fantastic presentation, and thanks to the team at Emory. I think these indicators are super helpful to provide an overall framework, much required to understand how gender evaluations and gender monitoring indicators should be measured. I think what is very important at this time is what Sujoy already mentioned, that the indicators and whatever research that we do as well as implementation needs to be context specific. So I think the first thing is that when we take this framework and these much required indicators, it should be done not at the national level also in a country like India, not just at the state level, but rather at the district level, rather at the urban local body level, because one realizes that even within the same state, you go to 3 different urban local bodies, the issues are completely different. So for instance, individual household toilets are very important for access to women, their health, their safe mobility. But if you will go to, say, a slum area, there may not be space to have that individual household toilet. So maybe they're just having a toilet which is accessible for 4-5 households also, which is still not the case in most places in India, becomes super helpful. So I think as researchers and evaluators, if I have to take that lens, the definition and the context of it as we use these indicators becomes important as to how we are measuring them. I think the second most important thing that becomes then is to create that kind of a demand, not just from the government, but also from the community and from the stakeholders. So there needs to be engagement, there needs to be input from the ground level practitioners who are engaged in this work as to what are the problems, where as we refine these indicators and work on them. I think the role of evidence-based studies becomes important in this case. And pardon my bias here, being an evaluation person, this will always be the case, because I really think that as we go across India, there are many good programs, implementation programs, as Anju was talking about. There are gender transformative policies also that are trying to take place. I think the problem is of dissemination. The problem is of hardcore, rigorous evidence. When we talk about, for instance, how does, say, menstruation or lack of toilets for adolescent girls leads to their dropout? So not just the availability of gender disaggregated data, but once that happens, what does that kind of evidence sort of entail for the uptake of girls for going to the schools as well? So that is required. And then creating that sensitivity, not just among the government stakeholders to create their buy-in, to ensure their buy-in, but also I think it is important to ensure that the monitoring comes at the community level also in that sense. So I think things like social audits, where there is more ownership among the community on the kind of the community toilets that are there, their maintenance, their uptake, when that kind of a ownership is embedded among the community, I think these some factors can play a crucial role in creating more ownership towards towards these indicators and having this kind of a framework. I'll pause here. Thank you.
Thank you so much. That means I thought, I think they both your interventions kind of are so well aligned, and it just demonstrates that in a sense, having it in the JMP WSS info is just the starting point for kick-starting so many processes of raising demand from the community, from below, from various institutions, incorporating context, but in a measurable way that can be equated or studied across geographies and represent every context, so to say, abstract in that sense, but also contributing to local benefits more realistically and visibly. So thanks so much for this. Asta, you want to come in for another minute? Here you go.
Sorry, I just wanted to say that I forgot to point out not just the contextualization, but also the intersectionality lens is very important as we talk about the gender indicator, especially in the context of a country like India, because the availability and the access and the agency, the parameters, the themes that we were talking about, very importantly, the Emory framework, they lie a lot on the intersectionality, on the caste, on the class, gender angle also of the people who are accessing it. So sorry, just wanted to bring in this, but yeah, that's all from my side. Thank you.
Thanks so much, Asta. I'd like to invite Dr. Isha Baisal to come in at this stage, please.
Thank you, Professor. You are calling me Doctor, so I'll call you Professor.
That's
I'm here to...
Hope.
Okay, yes. Yes. Thank you, everyone, for this opportunity, but also having to get to, see these wonderful presentations and also to hear from these experts. I'm not a gender expert, but I'll be talking from my experience. Based on our experience working with the IFIs and the government, of course, the governments have been progressive, as Anjuji also mentioned, how in the governments have progressed in terms of the policies or acts, and also at the same time, the IFIs requiring to mainstream the gender GWSC, let's say, into their sanitation program is something that we have seen. But what we also see is that, where is that connection between the planning and designing? Like when there is a technical intervention that's been planned and designed for a city, how does that translate into the GWSC, right? Like as Mr. Sujay mentioned that probably there is a community toilet that's being placed some 2 kilometers away, not considering the gender aspect of it. Having said that, what has been a little bit guiding for the program and the activities that we do has been the citywide inclusive sanitation, which has to a certain extent has been able to incorporate the GWSC component into the planning that we do. But having said that, what I also would like to say is, what Mr. Sujay has mentioned, to take the examples from rural and the urban, because there is a difference. Why I say the difference is that when we look into the rural context, it's more the community driven, right? And where it's much more easy to integrate because there is community awareness, there is community empowerment, where probably mainstreaming GWSC is much more easier than in the urban, where we are talking about the service provisions by urban, where the regulating, the government becomes more in a regulating role than in terms, so in that case, how can we facilitate in terms of the implementation of GWSC in rural and urban is something that is of comparable, and probably as we're talking about contextualizing the indicators would also come in there, because when we're talking about JMP, it's a nationwide, rural, urban and all. And when we look into the context of Nepal, where community-led, this WASH programs have been quite successful. And although Mr. Sujay also mentioned that there is more than 40% representation of women in the community, in the rural community WASH programs, similarly also in Nepal, where there has been a lot of successful cases of women gender GWSC being implemented for the successful running of these programs. But having said that, also the other thing is, how are we measuring these indicators when we are saying that, okay, there is a gender representation, but are we also taking into account that whatever they might just be in the case of appointee as in a role, but are they being heard? Are their decisions being taken into account? And is that making an impactful, is that translating into an impactful result, is something I think we'll also have to consider when we are talking about GWSC or gender mainstreaming and monitoring and evaluation. The other thing, what I would also like to highlight is in terms of the budget. When we look into the programs that we develop for sanitation program, it's usually very less in compared to the WASH programs are having a very less budget. Water might have significant budget, but when we're looking at sanitation, hygiene, and menstrual hygiene and all, it's very less. And on top of that, like having a GWSC program specific for GWSC is very less. So how can we see in terms of the budget allocation is also something I see as a challenge, but also as an opportunity. If there is a specific and explicit requirement from the funders or the IFIs to say that, or the government to say that, hey, we want a program with this kind of representation of GWSC, I think that would be very much positive, in a way to go. Community behavior change is something that I think is very much necessary and has to be measured, and also that has to be worked on. The only thing that is quite interesting for me is to see how the governance of this in rural, where it's more by the community led, and in the urban, where it's more by the private sector, can be balanced and can be learned. So this is something that I would like to add on in terms of but I pause for now. Yeah, thank you.
Thank you very much, Isha. That was very helpful. I'd like to give Dr. Sinha Roy and Anju a minute each to kind of respond to some of these comments that came up. Means what it seems to be clear is that there is enough efforts in projects, in evaluations that kind of create conditions, and in programs, as Anju mentioned, our national programs have been more focused on gender than they have been in the past. So there are a whole bunch of opportunities that come up for not only for M&E leading to transformation, let's say. So within this opportunity landscape, a few comments from your side. Maybe Sheila, if you go first, and then Anju.
Sure. Thank you so much for all of those comments. Really important points that were raised about rural-urban differences, contextualization, the need for intersectionality, of course, and focus on budgets by the donors. So, of course, I agree with all of those points. I think that, the JMP indicators that will be promoted now they, of course, have to be general and broad because they have to be applied globally. There can be lots of complementary data that can be collected to contextualize those indicators. These are a starting point. These are a way for all of us to advocate for additional data collection. So we can say that, okay, these are the indicators that must be collected, but maybe they are not sufficient for our particular context. We need additional data to contextualize these, to provide that intersectional lens that's so important to compare urban and rural. So the hope is that these can be a starting point for advocacy and for donors, like Isha was saying, to be able to raise awareness that additional funding is necessary to increase the focus on gender and integrate gender, not only in data collection, but in programs together. Thank you.
Yeah, so I also agree with what panelists have said, and some questions are there, and what Sheila already responded to. But I think what is important is also that sometimes we think of gender only in monitoring. I think this whole program and plans formulation also miss this important component of including most marginalized, like from the and they are most marginalized, of course, differ from context to context, but still. How do you involve women, transgenders in planning? We have seen in many cities where transgenders are being employed or have been given this economic empowerment, but still in their localities, they are not getting basic access to water and sanitation. So how do you start mobilizing these communities to be part of the planning process? Somebody asked in the Q&A about climate adaptation strategies and how those gender specific indicators could be built. I think it is all possible. It is, I think what I find is that governments only think of, physical and financial, resources, and thinking, how many toilets or how many infrastructure has been built, how much money has been spent, rather than, looking at the qualitative aspects of empowerment. So it will take time, but I think this is a new beginning in the sense that these specific gender specific indicators which have come through will spark more debates and discussions, and eventually programs have to see this from the planning stage to evaluation stage, how communities get involved. Yeah,
Thanks,
I think,
Anju.
and yeah.
Abhinav, do you have anything at this stage?
No.
Okay. Thank you so much to the panelists, to the presenters. We would need to go on to the next session, but I'll just like to leave a few words here around, about these, as I see it, it's a whole set of new opportunities which can drive a lot of change in the sector. Intersectionality can be driven from, it provides an entry point to looking at intersectionality in designing programs. I think I think we have quite an opportunity here. As we go on to the next session, which dwells into looking at a set of presentations that look at how this can be taken to the ground, both from the outcome and from a process point of view, with some early piloting that we have done and Athena has done. Dr. Malini is here. She'll be presenting on that. I will give over the moderation back to Anju for this session. Thank you very much, panelists, presenters, and participants. The participants, we will try and answer them in the Q&A itself. So thank you again, and over to you, Anju.
Yeah. So thank you very much. And in the session one has actually set the stage for second two. So what we call is keep, in India and in Hindi, especially the picture abhi baki hai dost. So you should not leave those who are leaving the room, because this is a very interesting session based on our, session one context. So this particular session is looking at, some of these indicators that we all, like Malini and we will be presenting. But let me tell you, and let me acknowledge, support from the NFSSM Alliance partners who helped taking this tool that we had developed from SCI-AI on, looking at services and infrastructure provided by ULB and how it is intentional, whether it is intentional or not, and leading to gender transformation or not. So we did this a very interesting pilot in some cities in India, in 3-4 states. Which will give you, which helped us to understand what are the challenges actually when you talk about monitoring. Similarly, Malini is going to also present a framework, which again has been developed with the support from Emory University and has been tried out in many countries in Sub-Sahara and Asia. And Malini is going to present on that. So these are some very interesting experiences that have come from the ground to understand monitoring and evaluation systems that are present and what needs to be done in that. So let me, just tell you that who are these panelists here. So you have met Abhinav, so I'm not going to repeat his introduction, but he will be joined by my other colleagues, Shaurya and Dr. Mohanty. Dr. Mohanty has been working with SCI-AI team for many years and has been working on water and sanitation as a senior WASH specialist in the team. Shaurya is a spatial data specialist, also working in the team for the last 3 years, and has been supporting this work on piloting work of gender that I was talking about. We are also joined by Malini, who will be presenting will be making a presentation on the framework that they have taken to the ground. And Malini is a director, governance and service delivery in Athena, has more than 25 years of experience of working on issues of inclusion and sanitation and many other relevant issues of development. And the panel, after these discussions and sessions, we will have 2 esteemed panelists, Padma, who is leading Kriya. She's the founder, she's the director there, and has been working in the sector on the issues of gender, sexuality, and health. And we also have Manitaji, who is from UMC. She's the founder in UMC and has been working, and he's an architect, but has been working on the issues of inclusion in sanitation, women, sanitation workers, and has been supporting Odisha government for many years. So these are some introductions. So I would request Abhinav and Shaurya, Dr. Mohanty, to start the presentation on piloting of gender checklist.
My screen visible?
Yes.
Yeah, we can see it.
Yeah, thank you. So we are predicting a pilot learning from our pilot opportunity that we developed in collaboration with NFSSM Alliance, which sort of focuses on gender intentionality of WASH infrastructure and services from the perspective of UL. So just taking the conversation forward from the last session. So we saw that at the global level also there's until recently, as we didn't have a gender specific indicators. Similarly, we see at the national level and state level also we see that there are no gender specific indicators. And as a consequence of this, the frameworks, there's not enough data on the in national surveys. So one of the yes, hello, yes. Yeah. So one of the things that we have highlighted in the previous session also is that as we move down the governance scale, we see that the lack of data and monitoring frameworks becomes weaker. So at the ULB level, with very little monitoring and data on gender in WASH. Next slide. So with that objective in mind, we started thinking about how can we measure gender in WASH at the ULB level. And there's 2 approaches basically of monitoring. One is process oriented and another is outcome oriented. In the process oriented, we focus on the implementation process and the service delivery methods, and mostly the engagement with the service providers like urban local bodies. Whereas an outcome oriented approach, the focus is more on long-term effect and impact of a project program on the target population. So we started with the process oriented approach with a lot of frameworks that are already doing the outcome oriented approach, and we have Dr. Malini also on the how has done it. So we focus on the process-oriented approach and start and try to look at analytic framework and the data collection from the ULB perspective. Next slide. So for this purpose, we developed the data collection tool, which was administered with ULBs, and we sort of collected data on 4 or 5 things. One is that it started looking at the the quality of community from a gender lens. It also started looking at the WASH in slum households, gender budgeting planning, WASH gender employment, and gender representation in WASH. So the reason why we are focusing on slum households is because most of the time sanitation is provided to households. So if we want to understand the access to sanitation for women, it's important to look at the household level infrastructure, and that's why we have sort of looked at slum households. It also provides us a glimpse into the most marginalized women in that sense and what kind of services and infrastructure are provided to them. Next slide. Yeah. So we sort of looked at this, we sort of our indicators are bucketed into these 6 categories. So the first category is where we're looking at gender intentionality of program implementing institutions and service providers. So we look at gender inclusive planning, and in that we look availability of sex segregated data for different services and different things that will be done. And then we look at whether all the sexes have equal participation within the ULP. Then we look at social security and we look at gender inclusive institutions. So gender inclusive.
Abhinav, excuse me,
Yeah.
your voice is a little muddled. Can you speak into the mic? Oh, yeah,
Yeah.
please make your,
Sure.
yeah, it is better.
Yeah. Then in gender inclusive institutions, we look at women and transgender employee, gender sensitization, protection against sexual harassment. And then we look at infrastructure and services, but from the ULB perspective. So when I say ULB perspective, we are looking at what ULB does to improve access. So for example, how they can provide sanitation, community toilets, water supply, and solid waste management services. Affordability, again, how the ULB role is to set tariffs for wash infrastructure and services, and how gender intentional are they when they are providing these tariffs. And next slide. Yeah, so these are some of the indicators that we have. So in access, we are looking at toilet, share of IHHL under SBM, gender compliance executed by community toilets, and host of other indicator and access. Similarly, in affordability, we are looking at different kind of what's the tariff for different kind of services, and whether women, transgenders, female-headed households, they are provided additional tariff or not. Then we look at the institutional level, where we look at participation of women and transgenders. We look at social security provided to sanitation workers in general, but women and transgenders in particular. Then we look at what are the different institutional processes which would make the institution itself gender inclusive. And then we look at the gender data gap, which sort of feeds into the planning process. Next one. Yeah. So once you've developed this tool, this pilot was done in 8 cities across 3 states in collaboration with our alliance partners. So these 8 cities were chosen in consultation with the alliance partners. So the methodology that we adopted was basically we administered data collection tool, which based on which ULBs provided us information regarding different questions in the tool. Then apart from that, the surveys also visited 2 of the community toilets, which were designated as improve or best services, best community toilets by the ULBs. And then based on the checklist, we sort of figured out what are the different services, different facilities that is available in the community toilet. And then we basically did a comparative analysis of cities to identify what kind of gaps exist with respect to data, with respect to service provision, with respect to gender intentionality in these cities. So the 8 cities that we have done, some of these are bigger cities. It's a mix of bigger cities and smaller cities. There are municipal corporations there, the ULBs. So we anonymized the states and the cities for the sake of, because a lot of this data has still not been shared back, so we have sort of anonymized it. So we across the 3 states, we have 8 cities, and there's a mix of cities, of bigger cities and smaller cities. Yeah. Next slide. Yeah. So now I will hand it over to Shaurya to take us through the data analysis that we have done and understand, and also take us through the indicators and the structure of the framework, monitoring framework that we have developed. Yeah, over to Shaurya.
So I will now move to the data analysis part. We begin our discussion with the first indicator, access to wash infrastructure and services. There are 4 components with which we have analyzed the access to wash: access to individual household toilets, piped water supply, gender compliance in community toilets, and solid waste collection. Firstly, to understand why it is crucial to look at these 4 components, let's understand what we mean by access to gender intentional wash infrastructure. When we talk about gender intentional wash infrastructure, we are focusing on facilities designed not only for basic sanitation needs, but also with specific considerations for need across all genders. For instance, a simple toilet isn't sufficient. It must be equipped with amenities such as water supply, which is crucial for cleanliness and also essential for menstrual hygiene. Gender intentional wash infrastructure aims to reduce the care burden, particularly on women, by providing facilities that minimize the time and effort required for its maintenance and use. If there is a toilet in the house without pipe water supply, that means whatever water is going to get used in that toilet, that has to be fetched by women, which increases the care burden on women. Similarly, for community toilet, just merely having a community toilet isn't sufficient. It needs to have other essential things to make it properly functional and effective for women and transgenders to use. Some of the traditional definitions also says of improved sanitation that it talks about various aspects like toilet facilities and desludging, but often overlook critical factors like pipe water supply, which significantly impact the gender considerations. which, going by the logic of care burden and cleanliness, is not very useful if you want to access a toilet from a gendered perspective. Therefore, it is crucial to look at all these four components to be more gender intentional. Moving to the next slide, we can see the comparative analysis of access to wash infrastructure across the 8 cities. We have scored each city on these components, and each of these components are assigned a score of 0.25, totaling to 1 for overall access. So if a city has a score of 0.25, that means it has scored maximum in that particular component. And if in any city you see one of the components missing, that means it has scored 0 on that component. The score 0 could be due to two reasons. One, that there is no data, and second, that there is insufficient infrastructure. In both the cases, it is scored 0. As in this slide, we can see that only few cities are providing piped water supply along with improved sanitation facilities. And we can also see in this bar chart that all the cities perform poorly on gender compliance of community toilets. We now move to our next indicator, which is on affordability of wash services. In our analysis, we evaluated affordability across 4 key components: the construction of IHL, tariff for community toilet, desludging tariff, and tariff for piped water. So we understand that making wash services affordable not only enhances accessibility for all, but it disproportionately is more advantageous for poor women and transgender groups. This advantage stems from the fact that women utilize these facilities more frequently than men for tasks such as bathing, cleaning, laundry, leading to a higher frequency and duration of use. Women's higher frequency and duration of use mean they bear a heavy financial burden when wash services are not affordable. Therefore, by making these services free or subsidized, women save more compared to men, contributing to their economic empowerment. So if you look at the analysis, we find a clear correlation that ensuring affordability of wash services is crucial for enabling access for women and transgender individuals. If you look at this chart, we can clearly see that affordability is very high as far as PTCT is concerned, but not that much of other services. Like there's no additional subsidy for construction of IHL, desludging tariff is not the same for everyone. Even for tariff for piped water supply, female-headed households are not getting advantage. So when you see some of the scores here, for example, 0.13 is an indication that there is a distinction in slum and non-slum households. But there's no distinction between female-headed and male-headed households, and that's why we've not given them the full score. Moving to the next indicator on participation, we now delve into the institutional process and its gender intentionality in WASH implementation. For this particular indicator, we have considered 2 major components for our analysis. Number 1 is the participation in city-level forum for sanitation, and the second is the participation in ward or neighborhood level forums for sanitation. As greater participation of women in decision-making roles not only enhances their agency, but also has a potential to improve water and sanitation access. While our data doesn't directly indicate its outcome, it highlights the significance of examining women and transgender participation in decision-making processes. So we are looking at the city level data, since much of the implementation happens at city level, while there's a growing emphasis on water and neighborhood level committees in service delivery. In this given slide, the data clearly shows that many cities have equal participation of women in wards and neighborhood committees, but participation of transgenders are inadequate. We can also see that city-level forums have inadequate representation of women and transgenders and are not active in most of the cities. So now moving to the next indicator of gender intentional institutions. There are 4 components on gender intentional institutions, and they're more likely to be more gender intentional in service delivery. So these are, as you may see, livelihood in WASH, gender sensitization, participation in WASH planning, and grievance redressal. For this particular indicator, we are trying to look at few of the things. Whether it is ensuring fair and equal employment opportunities for all genders within the institution, whether there is gender sensitization happening, whether consultations are happening with women, including the self-help groups and the users representing the diverse roles within the sector, and then to understand whether there's a POSH committee in place or not. And we also wanted to understand whether there's equal participation of men and women and transgenders in the institution. So we are trying to look at these parameters in our analysis. So coming to the analysis part, this graph highlights that while all cities conduct gender needs assessments, the level of consultation varies. Some cities only consult self-help groups while others engage with women representations and sanitation workers. Additionally, only 4 out of the 8 cities have a POSH committee. Therefore, it suggests that ULBs need to be more proactive in promoting gender intentionality by strengthening gender-related processes. Moving to the next indicator on social protection for the sanitation workforce in WASH, we now focus on the sanitation workforce, especially for women and transgender. Beyond merely assessing numbers, it's crucial to evaluate that institutions intend to hire the women. This involves implementing 2 key components. First, by providing the employment benefits like EPF and health benefits, which make sanitation work more attractive for women. And secondly, the training and capacity building is also very crucial. As we can see in this graph, only a few cities provide employment benefits to sanitation workers, and the number of women sanitation workers is fairly low. Whereas in few cities, male and female sanitation workers get equal opportunity for capacity building and training. However, the quality of data is relatively poor.
Shaurya, we can quickly move because the time is a constraint. Can you just finish in a minute?
Yeah, I will. So we now move to the last indicator. Here also we're trying to look at it with 4 key components. And in our exploration of the key data gap, our attention was drawn to the sex disaggregated and gender specific data. And so I'll just move to the next slide. So if we look at the graph and our analysis, we can observe a clear pattern. When there's a mandate to collect data, such as the employment or the program benefits, sex disaggregated data is collected consistently. However, in cases where there's no mandate, the collection of such data is either non-existent or of poor quality. And so basically, there needs to be a systematic approach to collect gender-specific and sex-disaggregated data, because without a mandate in place, the collection of such data remains inconsistent and inadequate. I would now like to hand it over to Dr. Mohanty to take us all through the key learnings of the study.
Yes, Surya. This study has brought up
Dr. Mohanty,
I'm audible.
No, you were freezed for a while. Please go ahead. Sorry.
The explicit mandate of inclusion in WASH policy is key in improving gender-related indicators, especially in livelihood, social security, and affordability. Strengthening of institutions like ULB, which is directly working with urban poor, is critical for achieving gender intentional outcomes. Comparative analysis of cities across varying policy approaches can foster cross learning between the cities for improving gender intentional outcomes. Need a bottom-up approach, bottom-up research and evidence is also critical for achieving gender intentional outcomes of WASH. Inadequate attention to data is a barrier for measuring gender intentional outcomes, particularly because gender disaggregated data is not available in the level, particularly in terms of their participation in the workforce, participation in different capacity building activities, also participation in different number of forums working within the urban body itself. And there is also no systematic method of data collection and reporting is also available in terms of gender, so far which concern. Lack of a consistent clarity among the officials hinder also compilation and maintenance of generated data across the urban bodies. Gender norms and
can we just close with 1 or 2 key points there?
1 second, yes. Gender norms are also not fully complied while implementing policy and programs on the ground across the ULBs. So that's all from my end. Thank you.
Thank you, Dr. Mohanty. You have finished the presentation.
Yes.
So thank you, Dr. Mohanty. This was one of the presentations. What I can suggest is that if we hear Malini also out, and then we have 2 such, initiatives from which we can draw some key lessons and also have some more question and answers and responses. So Malini, over to you. You want to share your slides, I hope?
Yes, I'll share my slides. Hello. Thank you, everyone. Just give me a second. Can you
Yeah,
see
we
my?
can see. Yeah,
All
you
right,
can see, but
fantastic. Thank you.
you can make it, you can make
thank
it
you,
full
everyone.
screen. Sorry, Malini, can you make it full screen? We are also seeing these, on the left side, these, smaller slides coming up. So it is making the screen very small. Can you make it full screen from below?
Is why make it
Okay.
full?
Or you can just proceed. Is it?
How do I
is it?
make it full screen?
You click on this, on the
Is
screen,
better?
you see this. Yeah, just it's coming. Yeah, it's better. Yes. Yeah, go on.
You see the full screen now?
Yeah, we can.
Awesome. Okay, thank you very much. And thank you to SCI-AI, which in the current world sounds really, really fancy and forward-looking, and GWSC and the Alliance. And thank you everyone for joining and giving me this opportunity to speak on MUSE, which stands for Measuring Urban Sanitation and Women Empowerment. This is a project which was, of course, anchored and led by Emory with support from the Bill and Melinda Gates Foundation. There are several partners in this project. It was tested on the field in the sea-wise cities in Africa and Asia, which means in India, Bangladesh, and Africa. And I'm going to be speaking about how this tool, which was developed under the MUSE project, can really support in program development and program improvement. So in a way, from the previous session, the points that were brought out by Anju, saying that how do we build transformative approaches for gender empowerment? How do we, Abhinav said, what are the frameworks available at the ULB level? Or Sujoy said, how do you measure the effect that a particular intervention would have that one is implementing and know that, yes, it's reaping the results we intended to. And also Asta talking about how do we bring in intersectionality at the ULB level and how do you contextualize? So I think in a way, this presentation touches upon these aspects. I represent Athena, and Athena was the data partner in this project and was closely associated with these some of the cities, and I'll be able to speak more from the point of view of how the data that comes out of using this tool can support decision making and can support in achieving women empowerment outcomes. Now, Sheila is here in the call. So Sheila, please feel free to jump in if I'm not doing justice in terms of explaining about MUSE, because my focus is really about speaking on the results. So please feel free to jump in if there is a requirement for any correction whatsoever. The background or the problem statement for the MUSE project was that we've all spoken about it right now, is that the role of women and girls in terms of household provision of WASH is well documented. However, to what extent the conditions of WASH and the interventions and policies impact women empowerment is unclear because of lack of tools to capture the data. Similarly, the impact of women's empowerment on WASH conditions is also not clearly known. And currently, till the time MUSE project was initiated, there were no fully validated WASH-specific measures to assess empowerment. And hence, the goal of the MUSE project was to create and validate measures of women's sanitation related empowerment focused in the urban areas. Having worked with the indicators, having worked with the scales, having looked at how the data is flowing when one uses this, I'm not sure if this is not something which would not be hugely relevant in the rural context. And I think one needs to look at it in terms of it's probably expansion into the rural context as well, but it was developed and tested in the urban context. When I said that there was no validated tools, essentially the process of tool development tends to be identifying domains, subdomains, and developing indicators, and then continuing with data collection on the indicators and monitoring the progress and the changes. Validation, on the other hand, involves multiple steps of statistical analysis to see if what you want to measure is what is actually being measured. And the scales which are developed under this are probably the only validated measure for women empowerment. And I think that is a point to be noted. And that is where contextualization, its ability to be applied in multiple contexts, that's where it gains its strength. Now, for developing the tool, the definition of empowerment that is used in the program is that empowerment is about expansion of choice, which is represented here in the framework by the domain of resources, and strengthening of voice, which is represented through the domain of agency, and transformation of power relationships, which is represented by the domain of institutional structures here, such that women and girls have more control over their lives and futures. Oftentimes, we confuse providing jobs with empowerment or providing education with empowerment. However, this definition takes a comprehensive view, and the conceptual framework includes 3 domains of resources, agency, and institutional structures, and 16 subdomains to capture the entire content. The process of scale development involved literature review and item generation, cognitive interviews in 2 cities, cognitive interviews and survey administration in 2 cities, followed by survey administration and validation in additional 6 cities. So currently, the entire ARISE scale, which is ARISE stands for Agency, Resources, Institutional Structures for Sanitation-Related Empowerment, comprises 16 scales. However, each of the 16 scales can be used independently, which means that if your programming is focused on a particular aspect of women empowerment, one can use only the scale that is relevant to that, and it need not you need not use the other scales. Of course, there are intersectionalities between the scales, and you will see that as we discuss the results from the field studies. But each of the 16 scales can be used independently. And ARISE scales are the only set of validated metrics for measurement of women empowerment and sanitation. The slide shows the 16 scales. So if your program is focused on leadership and collective action, one could be looking at measuring and using the ARISE scale only for leadership and collective action, and need not take the entire 16 scales together. Now, if you see the table of definitions, everything is available on the Muse website. And under agency, there are 4 subdomains: decision-making, leadership, collective action, freedom of movement. And there are specific questions to which combine to help you provide an understanding of each of the subdomains. So when it comes to decision-making, for an example, one is looking at not just decision-making about sanitation outside the home, but also inside the home, which in a way also has a leaning and some kind of intersectionality with the norms. It is what is the power one has in terms, and what are the social norms in terms of who makes decisions in general and in specific reference to sanitation. Therefore, while each of the scales can be used independently, there is merit in looking at the intersectionalities between the different scales. I would also be referring to these scales as we go forward and when we discuss about the results. But broadly, if you see the scales, the subdomains under the agency talk about ability to take decisions, ability to be in decision-making roles in both formal and informal contexts, ability to collectively come together and take action, and the kind of what kind of autonomy someone enjoys in terms of being able to access sanitation facilities. Institutional structure talks about power relationships, norms within the households, within the community, and with organizations which are involved in service delivery. In terms of resources, the tool covers ability of the woman's control over her body and ability to access the facilities and in the preferred locations. It talks about privacy, safety, how much time, who spends time on activities related to maintenance, and whether one has the knowledge and capability to be able to manage and take sanitation decisions and make sanitation related purchases. So these are the scales, and it was tested in these 8 cities, and the sample size was about 5,573. The questionnaire comprised questions under each of the subdomains and also some other questions related to menstruation and basic participant demography and access to water and sanitation and how it is being used. A point to be noted here is that the samples size was finalized with a view of what is sufficient for scale validation. It is not a representative sample of the city. Therefore, even the results that I present to you and share with you are essentially an example of how data collected can be put to use for decision making. And it's not really talking about the as-is situation of women empowerment in these 3 cities, because it's not a representative sample, but
Nalini,
it gives us a good idea.
May I just interrupt? Can we also quickly run through the slides? Because time is, there's 3 minutes left to your presentation.
Yeah. Are my slides moving?
Yeah, your slides are moving. Yeah, you keep going on. I'm just telling you the time.
Yeah, sure.
Time
Okay,
check.
so yeah, as I said, the results are really about understanding how the scales can be used for decision-making purpose. So let me just share with you some of the key takeaways from the surveys that were done in the 3 cities in India. The first takeaway is that across the 3 cities, the survey showed that women prioritized, or women said that they were deeply concerned about leadership and critical consciousness, which meant that women were keen on assuming leadership positions and participate in formal and informal sanitation initiatives and organizations, but were not sufficiently provided with the opportunities. Similarly, when it comes to the other aspect that they mentioned concerned about was critical consciousness, where women have said that their ability to call out inequalities with regards sanitation access and decision-making processes, and both inside and outside the household was quite limited, and that is an area of concern. So when it comes to empowerment, women are not always talking about access, but they're really talking about their agency, their ability to take decisions and influence how sanitation is provided and also used. Another takeaway is from the domain of subdomain of freedom of movement, where we see that except for in Warangal and Narsapur, where about 92 to 97% of women reported that they could use and go to any sanitation location alone without having to ask permissions. In Trichy, that percentage was found to be less at about 70%. Further, when it came to freedom or having the power to decide on ability to attend a community meeting or any training outside, Trichy, the data showed that that kind of freedom was quite limited in Trichy as compared to Narsapur and Warangal. Now, the implications of these findings is that when we are talking about taking measures of community participation and we take initiatives of creating forums and organizing meetings, perhaps one of the things which needs to be understood is whether women have the do they have that permission? Do they have to seek somebody's permission, or do they have that decision-making power to actually come and attend those meetings?
Malini, can we just summarize and speed up, because no time left. I think just
Yeah, another takeaway is in terms of norms, and we could find that women were continue to taking more responsibility than men. In terms of relations, one could also see whether there is comfort. Women feel comfortable in reporting their sanitation concerns to service providers. So all the helplines that we have, are they really being used, and why? What is the percentage of women who are using, and why that is low amongst women? This particular tool can also help us in making some corrective action. Also, in terms of their own knowledge and skills, so many women, I mean, almost less than 30% of all the respondents felt they do not have the right skills to be able to take sanitation related projects. So when we speak about bringing women into sanitation service delivery, what kind of comfort do they have in terms of knowledge and skills, etc., is also something that needs to be looked at. So these were some of the key takeaways, and how these takeaways will help in taking concerted decisions is, for example, if you take 4 aspects like decision-making, freedom of movement, safety, security, and privacy, and the intersectionalities of these domains, one can very clearly construe that just building a community toilet is not sufficient if the toilets are not safe and private. Moreover, even if they are safe and private and easily accessible, they may still need women may still require to take permissions to be able to use that. And the concerns about safety may still remain, and they may require someone to accompany them. So this is how the tool can be used. And in conclusion, I'd just like to say that ARISE under Muse, it offers a specialized and context-specific framework that will lead to actionable data for improving women's empowerment. It will help, it can be used as a pre and post to any program intervention. I'll leave the slides, of course, they'll be made available to you, but it's also, in this slide, I've also tried to provide a comparison between how ARISE compares to the other available tools, and therefore in what context would ARISE scale would be most appropriate for you to include in your programming. You may please visit the Muse website for resources on each of the city. The preliminary report is available. A validation paper has been published, and a user guide for how you can administer the questionnaire and how it can be used is in the final stages and will be made available, and training programs would also be conducted on this. Thank you very much. And this was the team which you could contact for any further information.
Thank you, Malini. Thank you so much. It's been very interesting presentation. So in the session 2, we actually, gained insights into having some indicators and testing them on the ground, which is, of course, a foundation for any M&D, how they are made context specific. And as Malini had said, I forgot to mention that both these, initiatives are from the urban, urban local bodies and from the urban areas. But I think they are they can be contextualized in the rural context and can be used also in various contexts, depending on, how you select and what is the context of that particular area. As Malini was saying, is in any case, done in many countries, and they're very good examples. And I would encourage all of you to go to the site and see each of these, findings from all the cities like Zambia and other places. Now I would move to, panelists before we move to question and answer session. So looking at first session presentation, which talks about some opportunities that exist considering JMP has released its gender-specific indicators, and national and country, nations have to take this up depending on where they are in the sanitation, stage. But what do you think? I would now encourage Padma for us to go and offer her comments on both these presentations, and basically looking at how then the ULBs can be promoted or can be encouraged to collect this kind of data, or any kind of data. But what I'm saying is that monitoring how they do this, especially when the national frameworks are also going to build some indicators, because all these indicators, the progress, the impacts have to come from bottom. So whether ULBs are prepared, what kind of capacities then are required for the ULBs, as well as for any other local governance institutions in various contexts of the country. And what are the main challenges that you see when you are working with the cities on the gender data gap, and how it can be resolved? What are your views on it? So Padma, you can go first, and then I'll go to Manita.
Yeah. Thank you. Thank you for having us here to share our experiences. And thank you to all the speakers for the webinar, especially the last two speakers. And I think what both the presentations have clearly done is they are moving this field forward by actually measuring and bringing in data and building evidence from the ground. And what I have to, say here and share our experiences is largely based on our direct work with urban local bodies, and through our collaboration with EY, CVOS, and IIHS. I see that some of the representatives from all the three institutions are here. So this is a shared learning that Kriya has kind of built over the last couple of years of having worked with ULBs. To answer your specific question, Anju, I think, we've talked a lot about what the policy says. I think there is a mandate. You have a very good review, critical review of how the policy in sanitation has evolved, the program guidelines. So in many aspects, as you've clearly said, it is gender intentional, and it is clearly mandating and clearly giving a roadmap of what urban local bodies are expected to do on the ground when it comes to urban sanitation. And with the, and they have a constitutional responsibility. With the 74th Amendment, the idea and the aim was to promote decentralization, enhance women's participation, and increase civic engagement. I mean, that's the mandate of the urban local body. And they are responsible for provision of services that are equitable, non-discriminatory, and they're responsive to diverse needs based on gender, disability, status of migration, because it's basically the ULB is responsible to ensure that everyone receives and has access to services. So that's their clear mandate. So I think that's very clear that, there is a constitutional mandate, there is a policy mandate, there is a clear roadmap from the program. Now, what are the challenges? The biggest challenge is the capacity of urban local bodies. And our experience shows that they don't know that this is what they're supposed to do. So they're, the fact that it is their responsibility to also be involved in planning. So, the absence of understanding, or the biggest missing gap that we find is that what does gender mean? That's not understood. So, somebody said that women, but even women is not understood. So it's a very limited understanding. I mean, even if we look at it only men, women, just having equal number of seats is not, bringing a gender perspective, because women need more, because they use the same, facility for both the jobs. So, I mean, there is a gap in what gender means. What does gender planning then mean? What does gender budgeting mean? So that gap is very clear. And that's something that we are, and therefore what needs to be done is really creating awareness about their role and mandate, and also giving them more resources and material and some kind of a manual or a way forward on how this can be done through engaging and supporting and handholding them, because only capacity building, we all know, does not lead to any kind of change. Apart from that, the other mandate that the ULBs have is participation. And it's not just the urban local body officials, but also the elected representatives. In most cities now, with this whole privatization, you have a whole range of contractors. So, how does ULB engage with these contractors? The whole issue of POSH, the fact that everybody who engages there is now mandated, and they have to be sensitized to POSH, and they come into the purview of those of the Act. So those are some of the things that require to be done. And also, the gender committees, ensuring that there's representation of women, of persons with disability, transgenders. So diverse views and opinions that need to be brought into the whole policy making and grievance redressal systems of the ULBs. I'll stop here.
Thank you. Well noted points here. In fact, in our sharing, we figure out, I mean, we also saw that these were major challenges that came in ULB. Thank you so much. Manvita, can you also, and also, if any, additional question is that if, these kind of systems have to be built, who pays for it? Who funds it? The government, if it has to come from state government, whether the programs fund or how these are done, even if you build these indicators or you build M&D systems, how are those to be taken up by ULB, the local bodies, the rural areas as well? Yeah, Manvita.
Thank you. Thank you, Anju. And first, let me congratulate. It's a very important topic which you've started the discourse, and happy to share what I think. Taking from what Padma also recently just mentioned and what Malini presented, research-based presentation. What is emerging is, if you see processes in the local governments, when do we do planning? And what do we do under planning processes? We talk about physical planning. Physical planning, we make good master plans, color it, each color has a meaning. But what kind of discourse happens within the ULB or parastatal, whether it's a urban development authority, economic planning with a gender lens? They don't. Planning processes are looked at as a very, very masculine activity, where you talk about needs of infrastructure, how many crores of projects, which, not that women don't understand that, but more finer aspects, more nuanced understanding of each ward. What is the demography? What are the needs? What are the livelihoods, needs and opportunities? Each ward in our cities are different. We don't look at, we paint the brush, use a brush and paint all over with similar colors. We need to have that discourse. So within the ULB, where is the opportunity, you tell me? There is no such opportunity where city administrators come together and would look at a gender lens. Whatever research today we spoke about, and it's very, very important, I'm not saying that, but we come from a community angle, which is important. And we've been doing at 3 levels of our work as well, working with the national government, with the state governments, city governments, and with community. And the shoe pinches, communities are coming together, organizations like us work communities. What happens when we work with state, national, or the state governments? There are no possibilities of discourse on gender. If there is no discourse, how would we work in fixing the gaps and talking about solutions or M&D for it? For instance, we started our work, we're working in the national government on livelihoods issues. And if you look at any advisory even which comes out of the mission, which is centered around working with women and transgenders and other vulnerable population, the text itself says he, right? The she is not accepted. So from that level to sensitizing officials and other administrators on what the needs are. When we talk about safety of women in the city governments, they say, oh, let's put a few light poles and street lights, maybe that will solve the problem. They will not address the real issue of her going early in the morning. Probably one is sanitation, the other is taking a transport appropriate time. Why does transport for women start after 12 noon? They say, oh, the buses will ply for women after 12 because only after completing her house chores she would move out. So we build a lot of assumptions in making those decisions. So along with planning, I'm adding urban management as well. Managing cities with a gender lens would give us a lot of insights into what needs to be done. Have a discourse within, prioritize sectors, put gender at front, and say maybe because she's a street vendor as well, she needs mobile connection, she needs street light, she needs a shed over her where she's vending. She needs buses and transportation to take her at 4 a.m. in the morning when she's going to sell her vegetables. The buses are not there. So things like that, if you start prioritizing with the planning offices, the things would be different. So my suggestion and submission here is when we talk of ULBs, we identify and organize within the department where, within that organization, a department who would hold this discourse. We have to work with the estate, we have to work with the planning department, and our plans cannot be updated every 10 years. It has to be annual review. When you ask a question about monitoring evaluation, who will do that? It is the planning department which would have that color, which would have that onus and responsibility to do it regularly and with that responsibility. I think I'll stop here. There are many, many case studies, but I think we're running out of time. So unless you have questions, I will stop here. Thank you.
So, yeah, thank you so much, Mamta and Padma, for your useful insights. And I agree to what you're saying. In fact, we all work with local bodies, and we face this. And I remember when the city sanitation plans were under the NUSP were, became the mandates, actually, then we also looked at city sanitation plans. It was hard. And nothing was mentioned on gender or, on the softer issue. That was more infrastructure, pipe and all that. So I think this is an important thing, and not only the ULVs, but I think when JMP is, progressing or asking the countries to have these indicators, I think this whole ecosystem has to work in the sense that, right from the planning and urban local bodies and the Panchayati Raj institutions have to look at the entire development agenda. So as you're saying, we are not looking at water and sanitation, but whether, it has a gendered approach in its planning, whether it is sanitation, whether it is livelihood, whether it is anything, transportation, because lives are not segmented, departments may be, but how then we make it, very gendered, orientated, then only we can think about WASH indicators and, having a monitoring system which is truly bottom up, which feeds into state and at the national level. Otherwise, it becomes very top down that some indicators go down to the state, they call up and then they collect the data, rather than having an organic process where these processes are so entwined into their systems that they, move organically. So I think the journey has begun with this push, which comes from JMP. But when we start at the working with the ULBs and Panchayati Raj institutions, capacities and all these are the very relevant questions, and I think are going to be challenges ahead. It's not that they're going to be solved, with these push from the national government. But I think this discourse, has to continue, and we may have to take, this forward with our experiences, evidences, and influence the national governments as well as the state government. So can I request somebody, if you have any questions, very I mean, there are many questions if somebody can, because like Sujaya has asked many questions. One is, of course, this continued M&A in cities, because this is, again, if this is so organic and built into the system, I don't think the funding is a problem. I mean, this is my take on it, that if you have a system where gender is so inbuilt into your planning, monitoring, financing, even you can do monitoring and evaluation in cities. It is not so costly an affair. You know, when you're building communities, the bottom-up monitoring also can be done. So I think this financing element and other things are important, but not something that cannot be done if there is a good intent. Yeah, so that was my, debrief from and key takeaways from this session, especially the session 2. And I thank all of you, the second session panelists and speakers, for your valuable time and insights. This also brings to, if somebody has to say, Shubhagatu, you want to come in and if you're there.
No, thank you so much. Thank you so much. No, I mean, it was really rewarding to hear both Malini's about the study that Malini presented, also Padma's comments, as well as Manvita, your insights into how the layers of challenges of working with ULBs on issues, to kind of align them to look at gender transformation, be partners in the process of. There is much to be done, so it's only exciting, I would say, that these challenges lie ahead of us. But thanks so much for this learning lab, because it did really raise a number of issues at this opportune juncture. So, Anju, means will you do some sort of thanks too before?
Yeah, no, I can do. I also wanted to tell participants here who have come and joined from various other countries. Like in India, we are, experiencing this. I think, you must also be facing similar opportunities and challenges in your context. And I think going forward, we have, these things to tackle together. And I would request all of you who have joined from different continents, countries, to be in touch and to share some of your experiences. And maybe, when we join again in some of these kinds of events, we have some, good stories from the ULBs and some kind of change we see in the administrators who can bring this change to the society. So that was something that I would urge all you participants for your wonderful participation and a lot of interest they've shown in Q&A. And what we will do is we will be in touch with all of you. And thank you so much, everybody. I would say that all our panelists and speakers, especially to Sheila, who had to wake up very early in the morning to be with us, and all the speakers who joined in this insightful discussion, and all the panelists. Thank you so much. It was a wonderful experience for all of us, though we were doing this, but we also wanted to learn from many of you who have, great expertise and experience in this field. So thank you so much. Yeah, and we will take it to next steps soon. And we'll again meet in any of these, such events where we can discuss together. Thank you so much. Thank you from the SCI-AI team. And I would really like to thank my colleagues also who did such hard work to put this learning lab together and to have this, discussion with all of you. Thank you so much. Thank you.
Thank you. Bye.
Thank you.
Bye-bye.